Now we want to explore with all of you what are the different treatments that you utilize to try to help treat and manage and live with those various symptoms and burdens, as well as what are some of the downsides of those various treatments. So I'll invite my second panel up onto the stage. In this topic, when I refer to treatments, I mean that in a very broad sense. Not only do we want to hear, of course, about medicines that you might use, whether medicines to directly treat your condition or medicines that you might use to treat and manage certain symptoms that you are living with, but also surgeries, other medical procedures, also medical devices that you use, perhaps mobility assistance devices that you utilize in daily life, but also think even more broadly than just medical products. This might be different techniques that you use in daily life, whether it's an exercise regime, diet, really anything, even like a lifestyle modification that just helps make your day a little bit easier. We really want to hear about this whole range of things, approaches that you use, again, to treat, manage, and live with your condition. As you share each of those things, and our panel shares each of those things, we're going to ask you to tell us how well those things are working, what are the downsides, and ultimately looking towards the future. Short of a cure for your condition, what specifically would you look for from a future treatment? So we want to know really what's that gap that's left, given everything that you do have. What is it looking towards the future that you would most want? And try to be as specific as you can in explaining to that, since we're talking about things that are short of a full-blown cure. So to get us started on this topic, we have another great panel for you. We have Sunindia, Billy, Jen, Brent, and Teresa, who are going to share their experiences and preferences, and I'll go ahead and turn it over to Sunindia to kick it off.
Good afternoon. My name is Sunindia Bala. I'm 36 years old. I live just outside of Boston, Massachusetts, and I'm the Senior Director of Community Impact at the United Way of Massachusetts Bay. I was diagnosed with XLH when I was 16 months old, after spending months in the hospital because my parents noticed that I was very bow-legged and not walking straight. I am a spontaneous case. I have taken medication to manage my XLH ever since I was diagnosed. I say manage instead of treat because there has been no treatment from my perspective until recently. For the past 2.5 years, I have been on Burosumab, the recently approved treatment for XLH. It is different from other medications that have been available in the past because it is not just supplementing the vitamins and minerals missing from my body, but is preventing my body from getting rid of them. So it feels to me that it's getting at the root cause of the disease, my body's overproduction of the hormone FGF23. Until I started Burosumab, I was taking active vitamin D and phosphate, which were constantly being fine-tuned throughout my life. As a child, I could not stomach the form of phosphate that was available, so my parents drove down to New York once a month to get a medication that was shipped all the way from France called Foslimar. It had to be dissolved in water and tasted horrible. For many years, I had to take this 4 times daily, being called out of class and therefore singled out in school, skipping doses whenever I could get away with it. Because of my XLH, I missed a significant amount of school for appointments and surgeries, and while I kept up with my schoolwork and was fortunate to be surrounded by caring and compassionate adults and peers, I was bullied, almost did not graduate because I did not fulfill the physical education requirement, missed graduations and special events, and had to find new hobbies and interests that were less physical. I also had to look for a college that was near enough to my doctors. During early adulthood, when I stopped growing, I stopped treatment. However, the pain was even worse as I started to get calcifications and enthesopathies, develop arthritis, and I quickly resumed my treatment. I now had the added stress of being my own advocate, managing my own medications, and having new physicians who knew little about XLH as I transitioned to adulthood. Around this time, I found the XLH network, which ultimately led me to Burosumab. Although Burosumab is not a cure, nor does it reverse the impact the disease has already had on my body, it is definitely controlling my XLH. For the first time, and as long as I can remember, I have moments of being pain-free. Since being on the drug, I haven't seen significant progression in my disease. This is confirmed by how I feel, what I'm able to do, and by x-rays. In terms of the physical aspects of my current treatment, I have yet to encounter many downsides. One significant downside is not knowing about any long-term side effects and what to expect. However, I am willing to take this risk since this disease is all about not knowing what the future will bring. Along those lines, stress is a constant downside of this and any treatment for XLH. It is really stressful navigating things like building my career while needing high quality and comprehensive health insurance coverage to be a strong factor in any decision I make. I struggle with how and when to discuss my disease with my employers, often waiting until I have no choice and need surgery again, not wanting my XLH to define me. All of this is in addition to the increased complexities of someone living with XLH in navigating relationships, wanting children, and everything else that comes with living my life. The most significant thing I look for in managing my XLH is pain management. XLH is not a visible disease, nor is it life-threatening, but it is chronically debilitating and life-altering. One thing I've learned as I've met more and more people with this disease is that we have a high tolerance for pain. That does not make it okay for us to have to tolerate so much constant pain. I will randomly wake up with excruciating joint pain when osteophytes dig into my hip muscles in my hips or knees. I know I need knee and hip replacements, but I'm told I'm too young, so I work through this pain as best I can. I have an uncanny ability to know when I need to listen to my body and see a doctor. I'll often get an urgent call after an X-ray or MRI from a radiologist who looks at my spine and thinks I should go to the emergency room ASAP because my spinal cord is about to be crushed. For the first time in my life, I found myself going against medical advice. Fortunately, since starting Burosumab, I now have a physician, Dr. Insonia, who is knowledgeable about XLH, trusts me and takes me seriously, does not jump to conclusions, is collaborative and willing to take some risks, and who is eager and willing to learn with and for me. I hope that future treatments can more significantly stop the progression of this disease and even reverse some of the painful effects. For someone like me who cannot take stronger pain medication than ibuprofen, pain management is crucial. Being on this drug has opened my eyes to the complexities and benefits of the medical and pharmaceutical industries and the infrastructure we have here in the U.S. and how committed these industries are to find treatments and cures for people like me. Thank you for letting me share my perspective.
My name is Billy Branch. I am 56 years of age and a typical case of X-linked hypophosphatemia. I acquired this condition from my mother, who has dealt with this debilitating disease for 79 years and continues to struggle daily. I am sorry to say that now I have passed this condition to my daughter, who will inevitably pass it to my grandchildren. As a teenager, I was diagnosed with hypophosphatemia, but was never started on a regimen of medications. I experienced some issues with bone pain, and I tried playing sports, but due to the bone pain, I was not able to continue. After high school, I joined the Navy, and still my XLH was left untreated. Despite the pain and physical limitations, I was able to get through 6 years of physical training, the demands of being in confined quarters, and working as a mechanic in the engine room. I now remember this time when I was working below the deck plates of the ship. I had to spend extra time lying on the deck because I was in such a tight space and I became so stiff I could barely move. Somehow, I managed to get myself out of those tight spots and to continue to move forward in the service. It wasn't until after my years in the Navy that I started experiencing more issues that were related to XLH. Again, I tried playing softball, but after one particular game, I could barely walk, and the next morning was hell. It was after this incident that I found an endocrinologist that was able to prescribe calcitrol and phosphorus. The large doses of phosphorus caused terrible stomach issues, and so I had to reduce the number of doses. When I reduced the number of doses, I felt that I wasn't getting any benefits from the medication, so I quit taking them. It was in my early to mid-30s when the symptoms became unbearable. I couldn't drive long distances due to the pain and stiffness. I could only drive for an hour or two before needing to stop and change position due to the pain and stiffness in my hips. A 4-hour road trip could take 6 hours, and with young kids, it seemed even longer. Are we there yet? During this time, I started having trouble walking after 30 minutes or more. When I stood up and tried to walk, I had excruciating pain in the Achilles tendon area of my feet. I had to find a problem, and that led to finding an orthopedic surgeon who, after examining my x-rays, recommended I get back on my meds in preparation for my upcoming surgery and the healing I would need to do. I had calcium depositing into my Achilles tendon, and every time I walked, it rubbed against the tendon, causing it to deteriorate. The need for surgery was urgent, as my doctor was concerned my Achilles would snap. I first had to get through a trip to Disney World with my daughter that I could not delay. I wore a walking boot to immobilize my right foot and to prevent any further damage to my Achilles throughout Disney World. Once I returned, a plan was formulated to repair my Achilles by removing it, grinding the calcium away, and reattaching the Achilles. This process did not work, as the calcium started returning quickly. One more attempt was made to clean the calcium out, and again, it did not work. The third time, a surgeon decided to do an FHL transfer, which did work. If you don't know what this entails, please look it up. It's no fun. After 2 surgeries for the same issue on my left foot, I was finally able to get around, although there are still days when I can't help but limp. While recovering from surgery and a period afterward, I was on 2 to 3 Vicodin daily just to be able to move. I had 5 surgeries in 2 years. This included 3 stents of 8 weeks at a time and a cast, multiple walking boots, and along with months of physical therapy. After I hit my 30s, the issues and procedures just seemed to keep coming. I had to have my thumb fused together because I could barely hold a pen. A lateral release on my kneecap due to calcium and scar tissue binding my kneecap up after an accident. There was a time when I stepped in a hole and fractured my femur. I had no idea I'd fractured my bone. I just knew it hurt. As with many of my fellow XLHers, the tolerance for pain is very high, and we grow to expect it daily. Approximately 10 years ago, I heard about a clinical trial for Burosumab, or at that time, KRN-23. I didn't know if it would help me, but I wanted to give it a try in hopes that it would help my daughter and the rest of future generations. I was in the initial study and have continued participation and have just completed the final phase a month ago. There were times when there were delays in getting to another phase of the study, and my body would let me know I need to get back on meds. When I first started Burosumab, I only had minor side effects such as terrible back pain. There were times if I jarred my spine or even just initially lying in the bed, I would get excruciating pain until I felt a little pop, and then it would subside. After several injections, that all disappeared, and I didn't have any other issues. I hope that continued study can be accomplished to figure out how to alleviate some of the other issues with XLH. One being teeth issues. This has always been a big and expensive issue for me, and hope some studies can be completed on this issue as well. I am worried that insurance won't pay for these meds, and that is a fight I'm having right now. I need to make sure that my daughter has access to Burosumab so she can lead a normal or as normal of life as possible. I never knew how bad I felt until I felt better on Burosumab. Thank you.
My name is Jen Jones. I'm 63 and have spontaneous XLH. I lived through the whole range of approaches to treatment, starting with massive doses of vitamin D, plus calcium in the 1960s, and then a brief stint with phosphorus and calcitriol. Nothing helped until I started the clinical trial for Burosumab. Despite the ineffective treatment, my childhood symptoms were not terribly bad. My legs were not visibly bowed, and while I was short, I was still taller than many XLHers due to my extremely tall parents. I was taken off treatment, such as it was, at the age of 16. What wasn't visible then from the outside was the weakness in my bones and muscles. As time went on, my body deteriorated. I first sought adult treatment in my late 20s when I developed serious knee pain. The osteoarthritis and osteomalacia were diagnosed, but there is no effective treatment, so the damage continued to progress. Of even more concern was something I didn't even know was happening. My soft tissues, ligaments and tendons, were calcifying. This is and continues to be the most debilitating symptom for me, with much of my spine so calcified, you can probably see that I can barely move my torso or my neck. I also have calcifications in my feet, knees, hips, and they all affect mobility and range of motion. Between the mobility restrictions and related pain and fatigue, I was unable to continue working as a lawyer, which is generally not a physically demanding career, but I had to stop by the age of 53 and had only been able to work part-time for 10 years before that, so it was fairly restrictive of my career. There is no current treatment that can reverse these calcifications once they occur. It was once believed that phosphorus supplementation might help, and as a result, I went on treatment in my late 40s, but I couldn't tolerate it. Phosphorus supplements, as others have mentioned, are known for causing gastrointestinal distress. And in my case, even the lowest dose of the phosphorus, which Dr. Einstein was always telling me wasn't clinically significant, still caused such serious gastrointestinal pain that I thought I had appendicitis. Keep in mind that I've had a broken arm and didn't even realize it, and it didn't bother me. So it takes a lot for me to notice pain. So I persisted with an extremely low dose of phosphorus in the hope of stabilizing my calcifications, which didn't happen. And over just a few years, the supplements kicked my parathyroids into high gear, and I needed to take yet another medication to bring the parathyroid levels back to normal. It appears that burosumab can at least stop the progression of these calcifications. It just can't reverse them. At age 60, I started in the phase 3 trials for burosumab, which normalized my phosphorus levels and seems to have halted the progression of calcifications. I used to have spinal spasms that would literally paralyze me, leaving me unable to breathe for a few seconds whenever my spine was jarred, like when I hit a pothole, was hugged by a friend, or simply turned over in bed. I no longer have those spasms and can do a lot more in a day before my fatigue and pain kick in to stop me. Unlike with the phosphorus supplements, I haven't experienced any significant side effects with burosumab. The regimen is simple, with just a single dose once a month. I am, of course, grateful for what burosumab is doing for me, but it can't undo the existing calcification and joint damage from before I started the treatment. The challenge for the future is that by the time adult patients notice the calcifications and seek out treatment, and remember we deal with pain pretty well, so we often delay treatment, by the time that happens, significant damage has already been done and it's too late to treat them effectively. The only way to prevent the calcifications is to go on effective treatment before they form, and it's still not known for sure whether even the best current treatment will be effective in stopping them. While burosumab is a life-changing improvement over both the earliest ineffective treatments of my childhood and the more recent marginally effective treatments with phosphorus, there is still more work to be done. We're getting closer to the source of the problem, but it's still not currently known why it is that the genetic mutation leads to the excessive production of FGF23, or why the tumors create excessive production of FGF23. If that process were better understood, a treatment might be developed to prevent the overproduction rather than simply blocking it once it's produced. And that, of course, is the ideal treatment, a cure. Something that could be done once, allowing the patient to live a normal life without the need for ongoing treatment and dealing with insurance issues. Short of a cure, the keys to an ideal treatment, I believe, are: one, it enables strong, straight, properly mineralized bones that are less prone to osteoarthritis. It prevents calcifications. It enables proper dental structure to form. It provides adequate phosphorus for muscle function. And 5, it doesn't trigger hyperparathyroidism or nephrocalcinosis. We've come a long way since the 1950s, but there still needs to be work to be done in making the whole life, whole body treatments more effective and less burdensome. Thank you.
My name is Brent Davidson, and I turned 40 in March of this year. But if you're judging by my x-rays alone, you'd probably think I was in my 80s. My birth mother, several of her siblings, and her father all had XLH. I was adopted immediately after birth, and then my birth mother informed the adoption agency that I would likely have XLH. The adoption agency, unfortunately, decided that the rarity of the condition was a potential breach of anonymity and chose to withhold the medical information from my adoptive parents. They were simply told I might have an inherited vitamin D deficiency and would probably need a supplement. It was not until I started walking and my legs bowed that I was finally diagnosed with what was at the time called vitamin D resistant rickets by Shriners Hospital in Houston, Texas. It wasn't until my biological mother managed to track me down around 2010 that I learned the term X-linked hypophosphatemia, or XLH. Through the years, I've dealt with multiple problems resulting from XLH, including many dental abscesses, spinal stenosis, hyperparathyroidism, bone spurs, soft tissue calcification, chronic bone, joint, and muscle pain, and limited range of motion in my back and legs. I wore leg braces for several years as a toddler to correct the bowing that occurred before the medications were started. Growing up, I was treated with calcitriol and phosphate supplements. Initially, the phosphate was in the form of Fleet Phosphosoda. My parents learned when I was a baby that the easiest way to get the medicine down me was to measure it in a syringe and squirt it down my throat. As I got older, we continued to use a syringe as a convenient way to measure and transport individual doses, which made for many embarrassing conversations with friends and teachers once I started school and had to carry my noon dose with me. I was eventually switched to K-Phos tablets, which made the dosing much easier and more palatable, but still caused relentless gastrointestinal issues. I always dreaded the first day of school and explaining to teachers that if I had a stomach attack, I wouldn't have time to ask permission before heading to the restroom. Most of my teachers were understanding, but it was still upsetting every time I'd feel that rumbling, cramping feeling in my stomach and having to jump up mid-lesson, head for the restroom, grab my backpack on the way out the door, just in case I need the spare set of clothes I kept with me. In addition to the digestive issues, calcitriol and phosphate therapy was always a delicate balance between receiving enough medication to keep the XLH under control and keeping the dosage low enough to prevent runaway parathyroid enlargement. My parathyroid levels began to rise to the point that calcium was being removed from my bones. Medication dosages were reduced to try to compensate, but my XLH then became more active and my legs began to bow again, and my parathyroid levels continued to rise. In 1986, before starting 5th grade, I had my first parathyroid surgery. Since that time, I've had 12 more surgeries to correct problems caused either directly by XLH, by side effects of treatments for XLH, or by incorrect treatment prescribed by doctors unfamiliar with XLH. The doctors at Shriners Hospital in Houston did an excellent job with my treatment, but since reaching adulthood, it has been a struggle to find a doctor who has even heard of XLH, and the few that have, most only recognize it from older papers they read during medical school. While calcitriol and phosphate therapy seem to have done an adequate job of facilitating proper bone development, there were many symptoms it could not treat, and the side effects ranged from inconvenient to potentially dangerous. I've already mentioned the numerous surgeries I've undergone and the digestive issues. I also have continuing dental issues. The majority of my adult teeth have abscessed and have either been root canaled or pulled and replaced with implants. I began walking with a cane before I turned 30 and have had to deal with moderate to severe chronic pain throughout my body. There's also the emotional toll of the frustration and anger at my own body when it refuses to cooperate with projects and activities my heart and mind choose to undertake. Fortunately, time and technology have given us Burosumab. I've been taking Burosumab since the first open-label human trials. Since starting Burosumab, I've gone from needing the 0.75 microgram per hour fentanyl patches to keep my pain marginally bearable to needing no pain meds, apart from cyclobenzaprine for muscle spasms and duloxetine for nerve pain, both of which stem from spinal stenosis. It's also enabled me to increase my physical activity enough to have lost 40 pounds and resume my hobbies. This January, I finally retired my cane, and at least until bone spurs around the base of my little toe and my right foot tore through the plantar fascia last Friday while moving some file cabinets. All those changes have come without any side effects for me. For someone who has lived their whole life dealing with XLH and the side effects of traditional treatments, Burosumab is truly a welcome change, but there's still work to be done. Burosumab requires a doctor or nurse visit for administration. Self-administration would be much more convenient. And Burosumab can't reverse the abnormal tooth development that causes our dental issues, and we don't yet know if it'll lessen those issues for children. An ideal adult treatment for XLH would be able to reverse the spinal stenosis, bone spurs, and other physical deformities that go along with XLH. There's also still data to be collected to determine whether Burosumab will lessen the impact of XLH on adults who were treated with burosumab as children. Compared to treatments of the past, burosumab is a giant leap forward, but it's just one small step on the long road to complete understanding of and ultimately cure for XLH. Thank you.
My name is Teresa Harner. I was diagnosed with XLH when I was 9 years old. My parents were concerned because my legs were extremely knock-kneed, and they took me to Children's Hospital to find out why. Calcium and phosphorus pills were the standard treatment in the 70s, and I took those several times a day, along with wearing straight leg braces at night and eventually at school. I hated those braces because they made me look different than all the other kids, and it was always a fight to make me wear them. Eventually, I stopped wearing them and just took the pills. When I was 15, I had surgery at Shriners Hospital in St. Louis to finally straighten my legs. Growing up, I played softball and basketball on our small town leagues. After my operation, a friend told me how her mom thought I was so brave to play in front of the whole school when my legs looked like that. I was shocked. That was the first time I realized how different I must look to people. Of course, I knew I was different. I was much shorter than everyone else and didn't have a lot of stamina. Gym class did a great job of pointing that out. We would strength train by jumping on and off the bleachers, and I was allowed to jump on the lower step, since the seat part where everyone else jumped only came all the way up to my thigh, and I couldn't jump that high. I also was the only kid who didn't have to run the hurdles. They came almost to my shoulders. I was allowed to run beside them, and at the time I thought it meant I was lazy and weak, and I realized later it was just a physical impossibility. You can't jump over something you can walk under. I've always had pain. Growing up, my knees would hyperextend if I did nothing more than stub my toe. There was nothing I could do but sit and hold my leg until the agonizing pain went away. Then I would get back up and continue the game of tag or whatever I was playing. In my 20s, the waddle in my gait became very pronounced. I would swing my legs around instead of pulling forward with my thigh. I couldn't understand why at the time. I know now that XLH affects my muscle tone a lot. Even though I walked and exercised consistently, my muscles just weren't strong enough to support correct walking. The waddle caused pain in my hips and back and really affected my self-esteem. By the time I was in my 30s, working and doing common household chores were becoming difficult. I was having more pronounced symptoms of XLH. There was bone pain, constant ringing in my ears, pronounced fatigue, multiple stress fractures, dental abscesses, and one episode where my leg muscles refused to work correctly. I had gone off treatment when I was 21. At the time, the doctors thought most people did not need treatment once they reached adulthood. I even put off looking into treatment or resuming it for as long as possible. I was willing to deal with the issues because the side effects of using KFOS and recalcitrol tablets scared me. They were kidney stones, calcification of your organs, and renal failure, and that was very scary. I finally sought treatment in my 40s when my legs stopped working correctly and I was using a walker and a wheelchair. Within 2 weeks of starting treatment, my muscles responded and I was walking again. The pills dealt with the most severe symptoms, but I still had a waddle, muscle weakness, bone pain, and ringing in my ears. I've been on the drug burosumab now for several years. Most of my symptoms are gone. The biggest improvement has been in my muscle tone. I no longer waddle or have back pain or get fatigued easily. I'm able to work a full day and walk several miles without distress. Some of the things the drug still does not address and that I deal with are the extra bone my body made and deposited in random places in my neck and back, the ringing in my ears, and the things that can't be undone. My short stature and my teeth that had to be pulled because the bone was too weak to hold them in, or they were infected because the dentin wasn't mineralized correctly and bacteria got into the root. There are 2 areas I struggle with in managing my disease. One is the cost of treatment. This disease requires ongoing medication and ongoing monitoring through doctor visits and lab work. Copays, deductibles, travel to a specialist, and other out-of-pocket expenses add up quickly. The second is finding a doctor who knows about or is willing to learn about XLH. I've had doctors' offices tell me that their doctors do not talk to specialists outside their practice, even if those specialists could give them vital information about me and my disease. Right now, I travel 3.5 hours to see Dr. Insomnia at Yale. I have an appointment with a doctor this month who's closer to where I live, and I'm hopeful that he's willing to talk with Dr. Insomnia and learn about and manage my XLH. Thank you.
So again, it is so tough to dig deep and bring up and share so many of these experiences from throughout your life. So Let's give this panel a round of applause.